It's a great pleasure for me to be here with the HHT Germany patient and to exchange a very incredible experience on this disease. One of my main field of research is the liver in HHT. Until 10 years ago, we thought that the liver involvement in HHT was not important. Now, using several sensitive methods like ultrasound, like CT, MRI, we have shown that the liver involvement in HHT patients is a very frequent condition. And it's important to know in an HHT patient how the liver is involved, how the liver is damaged. First of all, don't worry about the HHT patient because in most of the cases the liver involvement is a benign condition, just a modification to 3 times the normal values of hepatic enzyme. But in few cases there are also severe liver involvement. What is important for the HHT patient? I think it's important to know the state of their liver, and I strongly suggest a screening in every HHT patient in order to know if there are arteriovenous malformation, if this arteriovenous malformation can involve the liver function. In the other, once the HHT patient know his exact liver situation, can have different options. The first option is to wait, because the liver involvement, I told you, in 90% of cases is benign. In few cases, this liver involvement can bring to clinical severe hepatic symptoms, but we have at that point systemic therapy. We have in very severe cases, sometimes we can use the embolizations. In extreme situation, also the liver transplantation. Liver transplantation in good hands is a very good option in severe condition, because more than 90% of HHT patients survive and they improve their quality of life. Another good reason to make the screening of liver in HHT patient is due to have more clinical and morphological criteria in order to have a definitive diagnosis of HHT. At the moment, we know that we can do the diagnosis of HHT or Morbus Osler disease using genetic tests, but more using clinical criteria. In order to have the definite diagnosis, we need 3 clinical criteria: the presence of epistaxis, the telangiectasia, and the familiarity, and the involvement of visceral organs. In some cases, we have just 2 of these 4 criteria, and the fact to know the liver involvement in a very non-invasive way is very important to add the 3rd criterion in order to have a definite diagnosis of HHT. In conclusion, it's important to have a clear idea of the liver in HHT. The HHT patient has to be quiet in front of this involvement. Don't worry about the liver involvement. We have today good technique to have a clear diagnostic ideas, and we have also good therapeutical chances. Finally, just in this next few last years, we have new categories of drugs, like the anti-angiogenic drugs And this type of drugs can be very useful in order to determine the regression, in some case, of the liver involvement. I thank again all the HHD patients of the Germany Patient Association for this extraordinary exchange experience between Italian and German experience.